Everybody, we're now going to start off Unit 4, and just like we would have done in class, I want to talk to you for a handful of minutes about the outline before we get into the actual PowerPoint lectures. So half of this particular unit, the first half, Unit 4 PowerPoint 1, it's going to be broken into two portions, but on your Canvas page you'll see it's Part 1. That constitutes 50% of the exam, and Unit 4 PowerPoint 2, which are the pathogens, constitute the other 50% of your exam. So this one's going to be a little bit half and half. My thought is that everyone's going to love, especially the second half of this unit, because if you're not interested in pathogens and illnesses and infections, then it's kind of odd to think that your aspirations are in allied health or something in the medical field. So as we take a look at this, the beginning of PowerPoint 1 for Unit 4 is going to discuss the scientists. There are a handful of them. I need for you to know what they've done and what they're known for. And then we're going to talk about different kinds of drugs, also known as antimicrobial therapies. So chemotherapeutic will be an interesting topic because most of you, when you hear the word chemotherapy, if we were in class, I would ask, what does it make you think of? And pretty much the entire class will tell me cancer. But that isn't exactly the case. Chemotherapeutic agents, in simple terms, are drugs or medications. There's antiviral, antimicrobial, antifungal, anti-everything, and we'll cover those. So there'll be some terms like broad and narrow spectrum, the difference between bacteriostatic versus cytal. Then we're going to talk about the job that antibiotics have to complete to be effective. These 5 things are very commonsensical, so it will not be difficult. And then there are 5 modes of action in which antibacterial agents work. In English, that means there are 5 ways that drugs combat infections. And those 5 are written for you underneath here, right here, the 1 through 5. And if you would actually like to write in the information as we go along in the lecture, that's perfectly fine. So for each one, you're going to want to know one example for all of the 5 groups. And then, here, let's go to the next page. So all of the 5 groups, you're going to want to know a simple example. And then we're going to talk a little bit about other information regarding antimicrobial agents, which are, again, drugs. So what kind of things are we going to talk about? Some of the side effects, resistance, what you have to do to ensure that a bacterial infection can be fought off by antibiotics long-term, that you don't overuse and abuse them. When you take a look at this, some of the information on here, particularly this part right here, is additional or extra. I'll let you know during the lecture what you need to be tested on, but just like in the past 3 units, the outline is much more involved than the lecture, and your exams are coming from the lecture. So then you can turn back to these outlines for a little more information, but I want you to focus on that, not what's written on this document. Then this guy right here is something completely different. These are going to be 4 ways. This is going to be the 4 ways that drugs can be resisted by bacteria, or I'll say by the pathogen. In other words, the first 5 on the first page of the outline are 5 ways that drugs work. The second portion is going to talk about 4 ways that the bacteria fight off the drugs that we take to kill them. When you see the exam, don't mix up these 2 aspects because they are in fact very different. Then we're going to come back to, we're going to come back to this picture right here because everything we're talking about is seen in this picture, and this ties back to Unit 2. Next, we're going to look at susceptibility of drugs. So the x-axis is the days of treatment, whereas the y-axis is the number of organisms. And then we're going to look at the different color lines, which represent what's happening with the serum drug levels over time as you take medications. And yet again, the thwarting resistance. What kind of things can we do to ensure that our bodies don't become resistant to the drugs? And finally, at some point, you'll see on the end of our PowerPoint, there are all of these terms. So these guys, you need to know them all. So I'm going to ask you to do a small textbook definition. When we go through the pathogens in Unit 4, PowerPoint 2, I'm going to talk about symptoms. And many of these you'll know. You all know what symptoms are: infectious, non-infectious, communicable, contagious, non-communicable. Congenital is born with it. Nosocomial is hospital-borne. We've discussed this in another unit. Idiopathic is when something is unknown, like an unknown pain. Fibromyalgia, the illness, falls under idiopathic. And endemic is that it's related to a specific region. So please know the terms related to, or the definitions related to these terms. And here's a bunch more. These are all in correspondence with the pathogens that we're doing in the second half of the unit. We very much know what an epidemic and a pandemic is based on the state of affairs. That is why you're listening to me on video in the first place. Acute is essentially when you have a quick onslaught of symptoms. Also review from a previous unit. Chronic, think of TB. This is long-term, latent, it's sleeping. Sequelae we have also discussed. And then types of different infections. Local stays in one area. Systemic travels throughout the body. There's primary and secondary infections. Subclinical and asymptomatic fall nicely under our good old COVID-19, because for 2 weeks a person that has been infected is walking around asymptomatic with no symptoms whatsoever, infecting others. Some people are carriers for this particular virus we're dealing with, meaning they are asymptomatic but can still infect others. Iatrogenic, make sure you know what that is. This was in our previous list. And invasive versus non-invasive. And finally, there is transmission, which happen essentially 3 different ways: direct, indirect, and a vector. A vector is an inanimate object. So let's see, when you have, who sits by, I think it's Janae sitting next to Favi in my mind. I'm picturing you guys. Favi's chewing on her pen and she's got COVID-19 and she hands it over to Janae, who now starts chewing on the pen. The vector is actually the pen, which is the mode in which she passed the transmission on. And finally, we have disease development. We're going to do all of these in lectures. There's 5 of them. That's a pretty interesting topic to discover and talk about. Finally, there's the pathogens. And where are those questions? Hold on, I'm looking to show you the questions because they are in fact here, or I don't see them at all. Here they are. Okay, so here are the 9 questions, which are again going to be extra credit if you would like to do them for the exam, and please, I need you to do them. Notice number 9 just basically says, know the pathogens. So for this, I need you to do Unit 4, PowerPoint 2, parts A and B, written up. So this looks short, but it's deceptive. This is not short. So let's start Unit 4.